to the Lighter Side Show, where we unite in health. And we are so excited to announce a free monthly Women in Wellness event at Stories Coffee on 114th and Dodge, where women meet, have a cup of coffee, and talk all about health. I hope we can see you there. And if you want some more information, just please go to the Omaha Wellness Alliance.com. But today we are excited because we are going to be meeting Dr. Gavin Schneider, who is a licensed physical therapist, CrossFit coach, and strength and conditioning specialist. So glad you are here today. Thank you for coming. So we are so excited because just tell us, what do you do?
Yeah.
What is that? What is a CrossFit and what is physical therapy? What is all that?
Yeah, so I'm a physical therapist by trade, I tell people, but realistically, I'm a strength coach at heart. So as a physical therapist, I help people that have pain and injury in the way that people think as a physical therapist does. I just do it in a different atmosphere. So I don't live inside of a physical therapy clinic or an orthopedic clinic like what people think is in healthcare. I live inside of the gym. My space is there. That's where I see people. That's where I treat people, because I truly believe that fitness is healthcare. And so I take that approach, and instead of bringing that into what we consider the traditional healthcare setting, I have people come to the fitness world, and I help them in that world. So
let me stop you there. What do you talk about when you say the traditional healthcare system? What do you mean by that?
Without going into like a crazy, tangent and rabbit hole with that, I would say, traditionally healthcare, we're talking that you're going into a physical therapy clinic, or maybe you got a referral from your doctor, and you go to the physical therapy clinic and you're seen for maybe 15 to 30 minutes, maybe longer than that if you're lucky, if you're into a really good facility. And it tends to look a lot like a mill. They're kind of just trying to get people in and out. And that's a lot of times what I think of what our traditional healthcare system is it's not really focused on the human in front of you. It's really focused on,
the process.
Yeah, throw a diagnosis on that, code them, get them out, get to the next person, see as many people. It's volume based. It's not quality based. And I want the opposite of that. I want quality. I want to know every single human in front of me, and I want to spend time with you and have a conversation and do this thing. I want to build a relationship. I want to build trust. And then I truly want to help you as a human, not just your diagnosis that comes to me. I want to help you.
So they're not a diagnosis.
No.
They have a name.
Yes. Yeah. They're the people in front of me. Yep.
So what type of clients come to you? Like if I, like what ailments or what is the reason why they would say, oh my gosh, okay, I need to go get some PT?
Right. I would say commonly, like, you're going to see low back pain, shoulder pain, we see all of those diagnoses as well. But it can be really anything. I see people on the pain spectrum from that, like where they're coming in and maybe they've got a chronic issue that's just been bugging them for years. Maybe they have low back pain where they were lifting weights and just had an acute injury and need some help there. Or it could be performance based. But I would say for the most part, I call everybody, I see kind of the barbell athlete because I'm in the fitness world. And so I see a lot of people who are doing functional fitness. Maybe they're CrossFitting, powerlifting, they move weights, as something that they enjoy doing. But I also see everybody. I don't have to just see that niche. I mean, I really love that population, and I feel like I can really help those people stay in the gym. That's one of my biggest things is when it comes to health, we know that our fitness is a huge predictor of how long we're going to live and all-cause mortality and those things. So I want to make sure that those people can stay in the gym. And then if I'm lucky enough that somebody comes in and is like, hey, I'm dealing with this injury. I've not been able to work out for a really long time. I want to get back into, exercise. Can you help me with that? And that's like a home run for me. Hey, can I also help you with their pain and reestablish a fitness program that we know in the long run is going to matter much more than this acute episode of pain? That's huge for me. I want everybody to get into that fitness routine, that exercise routine, because we know how much more potent that is as a drug that, people can take in longevity and all of those things.
Well, and it's interesting you say that because I do know there's a lot of studies out there that shows muscle is really where you want to take it, is to have that protect bones and just to really develop that muscle. Do you suggest a nutrition aspect to it as well, eat more protein to develop those muscles? I mean, do you cover that as well? Or
yeah, so I try to really take a holistic approach. So when we have a conversation, say you come into the office to me and we're dealing with a low back pain, We're going to have a conversation around that, you know, and figure out what happened, where is this stemming from, what are the symptoms doing? Like, we're going to have that conversation that's related directly to your pain. And then I'm going to dive further into that picture, and we're going to have questions about, like, what does your sleep look like? You know, how are you sleeping? Are you not sleeping? What was your sleep like before the issue? And then what's your sleep look like now? And then we're going to have conversation about nutrition. Like, what are you eating? Because we know, again, like you said, protein is huge. It's our builder, it's our foundation. And we don't eat enough. A lot of people don't. And there's so much, you know, there's so much information out there, especially in nutrition and health and fitness world of like, how do we muddle through, like, what's the right amount, right? Because, you know, the government standard is one thing. And then realistically, like, what our body really needs, especially when you're exercising and you're doing more than just sitting on a couch, looks completely different. And so I've got to have that conversation with people to make sure that they understand that they may not be getting enough protein. And that wheels back to the pain thing too, right? We know when it comes to pain that nutrition affects that. You know, the types of things you're consuming. If you're getting a ton of added sugar in your diet, that's a huge inflammatory issue inside your body. So I have to have those conversations, because if I want somebody to truly recover from an injury and to honestly be better than before, because I'm not looking for just back to normal, like that to me isn't the standard. Like, I want better, because normal got you to where you were, right? Like, if somebody came to me with low back pain, their normal led to this moment right now. And so I want to take better. I want to take you one step further so that we can try to be protective against that ever happening again.
You know, it's exciting. You definitely have a lot of passion around this.
I love it.
Yeah, I can tell. So I mean, is there a certain place that you came from to get you to this point? I mean, like, what drove you to this wellness path?
Yeah, you know, I'll step back a ways, I guess. We could start, like, I tore my ACL in high school, so like that's where the PT career thing stemmed. I went to physical therapy. I had surgery. I had a couple surgeries actually in high school. So that's where I had the kind of introduction to physical therapy. I went to PT school, and then I was really quick to find out that, like, I like what we do, but I didn't love how we did it, and kind of like the box that we were kind of pushed to work in, right? Like, they kind of, I don't know, produce physical therapists in a way that they want you to work in the way that our system is built. And so as I'm going through school, I'm thinking, how can I take this and make it into what I really think is going to be helpful to the community? Because my background at that point was strength and conditioning. My undergrad, I was exercise physiology. So I was really in that world. And then I stepped more into the healthcare setting and thought, like, you know, why are these things so polarly opposite, right? Like, why is it that if I go to a personal trainer or somebody who's in the fitness realm, they're going to tell me one thing, but if I go to my doctor, you know, if I have an injury or an issue there, they're probably going to tell me to stop, or they're going to tell me a completely different story. And like, why are they so opposite when really, like, they should be like this? It should be together.
You would think so.
Yeah, we should be doing these things together. And I just was like, why is this happening? And so all through PT school, I was like, man, like, did I make a mistake? Like, did I actually not want to do this? Like, and I'm panicking a little, you know, because it was very early. Like, my second day of school, I was like, holy cow, I might have made a mistake. And so I went through all that. I got done, and I jumped into orthopedics. So right after, I thought, you know, I'm just going to go outpatient ortho, went right into it, dove into it, and started working. And I just kept, like, running into these walls of, like, I want to help these people do more than just, like, focus on their injury, but I just didn't have time, or insurance wasn't covering it, which we can go into a whole different realm about insurance. But that's like a 2-hour, you know. So I'll say that much about it is, you know, there's those roadblocks that I just kept hitting, and it just, you know, it's just chipping away at me. It's just frustrating. And so I finally kind of hit the point where I was like, I'm either going to leave this career because I think I can make more of a difference as a trainer, as a coach, or I'm going to do something that is starting to happen in the country, but just not super popular. And so I threw in my 3 weeks notice of my job. I was like, I'm going to just start a business. I'm going to start calling gyms and see if I can get into a gym. And then I got lucky, got into a space, and kind of just went full head into, like, how can I bring these two worlds together and truly help the people that need help?
You know, that's interesting, because I've noticed there's a trend just with people like you who see the polar opposites of healthcare and what people really, you know, need, and there's that gap. Yeah. And you're stepping in to that gap, and, you know, that like functional nutritionists are
Exactly.
stepping into that gap. And it's great because it seems like you're really trying to look at the person as a whole and not that one particular symptom, because
Right.
usually that symptom doesn't indicate root cause.
No, it doesn't.
No. What I have to ask, so like what were the injuries that happened to cause you to get PT?
Oh
yeah.
man, so I tore my ACL playing football.
Oh.
Somebody put their helmet in the side of my knee when my foot was planted. So tore my ACL then, had a reconstruction, second surgery, which, you know, as a physical therapist now, I'm like, man, I probably shouldn't have had that second surgery.
Isn't
but
that
whatever.
interesting? So why do you say that? Because, you know, that's interesting because I get a lot of that. It's that second surgery.
Yeah.
So what happened? Like, why do you think? I'm curious.
Yeah, you know, so I had the first one, went through all the stuff, and I was playing basketball when the second issue started to happen. I just started like, it was just some vague knee pain. Like it wasn't my ACL, I didn't blow anything out, no specific injury, but it was just vague, and it would, you know, with jumping and stuff didn't feel comfortable. And so, you know, again, I got taken into the doctor, and they kind of were like, well, there's some of these things going on. Let's, like, you know, try some PT stuff again, right? So I go through PT, I do those things, and then they were like, finally, there's like, we'll take an X-ray, and they're like, well, it looks like your cartilage is kind of like off, like we can just go in there and clean it up. And again, I'm, you know, 16, 17 maybe at this point, and so I'm like, well, if it's going to help, and my parents don't know.
Yeah, exactly.
You know, they don't.
Happened to my son, so yeah.
No medical background, and so they're like, well, I guess if that's going to help, like, let's do it. And so scope my knee a second time, and, you know, again, it realistically probably didn't change anything. And we know now, like, those cartilage symptoms, meniscus, like a lot of those things internally in the joint, like whether you have surgery or not, the outcome a year later is no different.
Interesting.
And so, you know, I could have gone the non-surgical path, and we know every time you open up and have a surgery, like, that's altering to your body, it changes, and you can't change those things.
Yeah.
But again, it's in the past. It is, and I deal with it now. You know, I do the things that I need to do, and I can still function and squat and lift weights and do those things. And I just know how much more important it is for me to take care of that. So that was kind of what stemmed me in that direction.
Well, and it's a great life lesson to really bring to your clients of like, okay, there's another alternative, you know, for this. And what's very exciting is that there is a Wellness Revolution Summit coming May 11th, and you are going to be a speaker there.
Yes.
So what led you to that?
You know, it's crazy. Like, you know, Omaha, like, here is it's a big but small community. Like, it's just the networks. And so I was fortunate enough, I know a nurse practitioner, Brenda, who just happens to be in my space in the gym that I work out of. And she was like, hey, would you ever, like, want to, you know, speak at anything? Like, do you have interest in that? And I said, yeah, I'd love to. Like, I mean, I truly believe as a physical therapist, like, I'm an educator anyway. Like, that's what I do. And so I was like, yeah, I'd love to. I'll preach to people anytime. Like, if I can spread the fitness love out there, like, let's do that. And so she's like, hey, I know this person who's trying to put together the summit, and she just connected the dots, and we met and hit it off, and it was like, yeah, let's do this. Like, let's promote this for people.
And what are you going to be talking about?
I'm going to talk about kind of this fitness is healthcare revolution thing. And again, it's going to come from, you know, aspects of pain and how we manage that and recovery. And again, more on the side of like how we use fitness for that and how we can use sleep and nutrition and just bringing all of those factors into our life instead of just focusing on like, okay, I have pain, what exercises do I need to do? Or I have pain, and can you dry needle me, or can you cut me, or can you do these things? Like, I want to help people know that that's just a very small piece of the recovery process, and that there's so many more factors that matter. And you know it from a nutrition standpoint, you well know like how that affects the body. And we know as humans, like if you eat a really trashy meal, we don't feel super great.
But do humans know that? I mean,
Well,
because
true.
Let's think
That
about
is
that,
true.
right? Because I think a lot of people are so used to feeling like crap
Yes.
that they don't know what feeling better
Yep.
is, right? And so
Yep.
to really get this word out to say there is another space to live, you just have to start living that, but
Yeah.
it's getting that stepping stone, right? And that's why, like, you know, people like you and, you know, the Wellness Revolution
Right.
Summit coming to let people know that there is this other space,
Yeah.
right? I mean, how do you try to get the word out? I mean, is it just, I mean, how does that work for you? I mean, because
It's hard.
because it is hard because I don't think people realize,
Yeah.
right?
Yeah, and I think, the Midwest is hard. Like I feel like we're slower to adopt things. Like this kind of healthcare that, the 2.0 or 3.0 version, whatever you call it, like the healthcare that we're leveling up into, that's not just reactive healthcare, right? Like where we're just like, hey, I'm sick.
Explain reactive healthcare.
So reactive meaning like if you came, like you're hurt, you're hurt or you're sick, and you come to me and you're like, hey, I need some help. So it's basically something happens to you and we're going into healthcare to help with it after it's happened, right? And so we're trying to shift away from that reactive thing. Let's go to proactive, right? Like this is kind of that next level of what I really believe true healthcare is we don't wait for the problem to start. We start having conversations with you, about your lifestyle and, health history things, and just start saying, hey, like this is some things in your life that I think that we maybe need to start looking at now, and we start doing things to do preventative medicine. And again, prevention is not perfect. If I have somebody come to me and they say, hey, I know I've got kind of this weak leg over here and I'm worried that something's going to happen to it. Like, what can I do to prevent something happening?
Do people come to you for preventive?
Yeah.
Oh,
yeah.
perfect.
And I honestly, that's where I try to shift people is like, can we get to a point where like, I'm kind of your wellness stop, right? Like come in, let's have a conversation about, all those other factors, nutrition, sleep. If they need help in those, I'm going to refer out. I'm not a nutritionist. I have a very good knowledge base when it comes to nutrition and pain and performance and those types of things. But if somebody needs true nutritional advice, especially based on a diagnosis of some sort, if you're type 2 diabetic, like those things, like I'm not a registered dietitian, like I can't make those choices, but I can help when it comes to recovery and all those other things. And so we're gonna have those conversations. And then we can talk about like, hey, I noticed like side to side or when you squat or when those patterns happens, like you kind of do this thing, like let's clean this up a little bit. Let's build you up in the right places. Let's make sure that you move well so that we can reduce that risk. Because again, I can't prevent you completely. I can't 100% say, hey, if you do this exercise, I promise you'll never get hurt again.
Well, who can?
Right.
Yeah, I mean, nobody can.
Right.
I mean,
but some people they really want that, right?
Yeah.
They want the pill, they want the fix, they want those quick things. And, for me, that's a big education piece when people come to me is like, hey, like, this requires work from you. Like, I can help you, I can guide you, I can support you, but I can't do the work for you.
How do we tell people like you can do this, but you really need to step in it because the quick fix isn't going to work? Where did we get this mentality? I mean, is this like a human nature thing? I mean, where did we get this? I mean, I know you want the easy because life can be very stressful and hard, but it's just the way it is. I mean, what do you think about that? I mean,
man, it's a real rabbit hole now. I don't know. I really think it's the shift, like societal shift that's happened over years and years and years. I think that the things that we've learned to be easy, like it's simple things, our ability to get from one place to another in minutes or hours, instead of, having to walk or, the commute's changing and like fast food and like everything in the world now that we know is so instant. I can pull out my phone and order food and it can be here in 15 minutes and I don't have to leave this space. And so I think we've slowly as a society just started realizing like, I want things now because we have that capability.
Yeah.
And now it's just trickled over into every piece of our life. Not only do I want my food now and not only do I want all these things, I want weight loss to be instant. I want a pill that requires no work on my side so that I can get it done. And I want a device that I can connect to my abs that's going to give me abs and, do those things.
Is there something out there like
There
that?
are plenty of devices that claim that. It's scary.
Wow.
If you go on the internet, it is so scary. Or postural devices that, fix your posture and things like that. And that's what makes health and fitness hard is because there's so many things out there claiming that they can fix your problems, right? And that's realistically like when people come in to us, as providers, they're like, hey, I need you to help me fix this problem. I have a problem and I need you to help me fix it. And when you find a device that's like, hey, for 30 days, if you take this pill, you're going to lose 20 pounds. Or they come to you and you're like, hey, you can do this. I promise you that you can do this. And here's the guide and here's what you need to do. But it's not going to take 30 days. It's going to take work on your part. But you're going to actually continue to live this process. You're going to feel better. And this is going to be maintainable for the rest of your life.
Yeah.
They're still going to look at this and go, 30-day pill, no work. or work.
Yeah.
And they're going to choose that because it's just inherently like people have fallen into that. And I think we've softened a little bit. Like people don't want to do hard things. They don't like to feel uncomfortable and they want the easy, quick thing.
But you have to admit though, when people step into your space and you're showing them the process, that when they start seeing results, is it like almost addictive? Like, oh my gosh, this is eye-opening. I mean, that happens, right?
Yeah, and it happens all the time.
Oh, it does, okay.
I would say more often than not, people are like, wow, like, you know what, this actually really does work. Like, you aren't kidding. And then if I can get that like tiny bit of buy-in, you know, sometimes that might take once, sometimes that might take a couple times. But if I can get that buy-in, then we can really start layering on those conversations of like, hey, not only like in this moment is this really good, here's what's going to happen in 10 years. And here's what's going to happen in 20 years. Like, here's where I'm looking for you. I know you're thinking right now, but like my mind right now, I'm thinking about like, hey, I want you, Susan, in front of me in 20 years to be able to do all the things that you love to do. I want you to feel comfortable about getting on and off of the toilet. I want you to be able to go hike. I want you to bike. I want you to do all those things that you want to be able to do when you hit your 70s and 80s. Like that's the mindset I have of why it's so important to start this stuff now and to do this stuff now. Is we want to gain that fitness now. Well, it's relatively easy because as each year goes by, as each decade goes by, it gets harder and harder. And so if I can get it now, we're protecting for later, right?
Yes. And I think, and I do believe the best, you were talking about posture. The best way in all those devices is like building the muscle.
Yeah.
Yeah.
Get strong.
Exactly. Because I mean, our bodies are meant to heal, and our bodies want us to survive and to thrive. And we just don't know how to listen to it. And it's like, and we don't know, and it's not a fault of ours. We just don't know.
Yeah.
And so that's why stepping into that health space is so important. And I think it's great, you know, for the efforts that, you know, you are doing. How long have you been in business for?
I think I'm on 4 years now, actually. It feels crazy to say it's been that long, but.
Oh, that's awesome. And then did your whole family subscribe to it? Like your wife and daughter? I mean, you teaching them to do some.
Oh yeah. Oh yeah. My daughter's like, I always joke with people sometimes because like she's really grown up in the fitness space, and like my daughter can deadlift like a 30 or 40 pound kettlebell.
She's 5 years old.
Yeah. And she can rope climb, like, you know, like, and I'm like, man, these are like simple, you know, when I was in physical education, you know, like back in the day, we had to rope climb, we had to do stuff, and like things have changed. But yeah, she's into it. Like I'm 100% on like, let's start this stuff young, because I don't want her to know any different. I want fitness just to be a part of her life, and her to understand that and take that with her forever. So yeah, they're all into it. So I try to get every person I can to buy into it. So
that's awesome. And just with that rope climb, I used to rope climb all the time, like climb trees when I was young and stuff like that. But what muscles? Because I would love to be able to do that again. What muscles?
It's a lot of. It depends if you use your legs. I mean, but
you
realistically,
have to use your legs, right?
Yes. You can. There is such a thing, you know, as a legless rope climb, which is extremely challenging.
Good Lord.
But yeah, I mean, it's a full body thing. You're using all those back muscles. I mean, your legs are getting into it when you're using those legs to kind of set up on that rope. I mean, it's a fantastic exercise.
Yeah, I bet it is. I've been doing a lot of rope exercises at the gym.
The battle ropes, heck yeah.
Oh my goodness.
Yeah.
Doing the squats, and then that's a good shoulder workout.
It's awesome.
Pretty good, and it's kind of nice because it's a simple tool, but it's definitely a good workout. Do you utilize those?
Yeah,
I'm sure you
do.
do. Yeah.
Oh, yeah. Rope slams. I mean, and you can have people pull stuff with those.
It works your core.
Yeah, yeah. It's
absolutely
awesome.
Yeah, and it is, and it's just something that we have to keep moving.
Yeah.
You know, and just keep our bodies moving, and it's kind of nice. And I don't know why I'm like so talking about the ropes, but they're not weights, and I know a lot of people can be very intimidated about weights, and these ropes are. I mean, they're heavy, but they're not that heavy.
Right.
So.
Yeah, it does. It does help.
So with the Wellness Revolution Summit, this is just a great place for people to connect with people like you and me, and it's a great to really understand the locals, you know, professions that they can go to. I mean, would you have anything else to say about the summit, or to tell the audience on what your purpose is involved in this?
I mean, I think the summit is just a perfect place to come and, you know, maybe step into the gray space, right? Like there's a lot of us out here that we're kind of stepping away with both extremes. And I think it's a perfect place that if you're looking for something else, like if you struggled, if you've had chronic issues, or you've just bounced around too much, or you're just looking for accountability, like in so many aspects. I think that there's a lot of us providers out there that we've stepped into that space and we're trying to fill that gap. But we're fighting a very uphill battle against what we've just traditionally been taught. You know, we've just kind of been taught like, hey, if something happens or you get sick, you go to the doctor, they're going to prescribe you medicine. You take the medicine and you kind of slow down and rest and do your thing. And then you go on with life, and repeat that process. And the doctors will just tell you where to go. And we're finding that like, that's just not working well.
Yeah.
You know, there's just so much more. We need to work with the human in front of us, because each human, like you said, we're very unique. Our bodies are extremely amazing. And if you support them appropriately, if you listen to them, they communicate a little bit, just not in the ways that we think about. We can actually help the person, and we can help them with their long-term effects, you know, because it's really, we're looking at not just, again, that moment in time. We can help over long periods. And so I think the summit's going to do a really good job of just showing that like there's not just this one thing anymore. It's not just this like traditional healthcare model. There's so many of us in this place that like we're trying to upgrade. We're trying to level up what healthcare really looks like, and truly put, you know, I always tell people like truly put health in healthcare. You know, I think we look at sick care right now. Realistically, if you want to look at it, like there's so many of us that we're trying to put health back into it. And I think that's important for people to know.
And I think it's a great place, so if you're looking for something holistic, the Wellness Revolution Summit is a great place. We've got a speaker,
Yes.
Dr. Schneider. He will be there.
Let's do it.
May 11th, and I believe tickets are on sale now.
Yes.
But you can just go to the website, and thank you so much
Yes.
for coming on, and I look
appreciate
forward to
it.
seeing you May 11th again.
Thank you so much.